Welcome to Vital Terms, the medical terminology podcast by Language Access Academy. Today, we're taking a whirlwind tour through 93 essential respiratory terms. Whether you're revisiting familiar concepts or discovering new ones, we've got fun facts to keep things lively. Let's dive in. Respiratory means relating to breathing or the organs used in breathing. Fun fact, your body takes over 20,000 breaths a day without you even noticing. An ENT doctor is a specialist in disorders of the ear, nose, and throat, also known as otorhinolaryngologist or otolaryngologist. Did you know the nose can detect millions of different scents? And the nostrils are the two gateways to fresh air and all the smells. Simple yet essential. Sinuses or sinus means air cavities in your cranial bones, especially near your nose. These little pockets help regulate the temperature and humidity of the air entering your body. Tonsils refer to the lymphoid tissues on each side of the throat that help protect your immune system. They're like your body's early warning system for infections. Tonsillectomy is the surgical removal of one or both tonsils, sometimes a necessary step on the journey to better health. Adenoids refer to a mass of lymphatic tissue in the nasal cavity that plays a role in your immune defense, especially in children. Larynx or voice box is the part of the respiratory tract that houses the vocal cords. It's where your unique voice is born, truly a gift to share with the world. Pharynx is another word for throat. Epiglottis is the uppermost cartilage of the larynx that covers the airway during swallowing, a small flap with a big job. Trachea is the windpipe that carries air from your throat to your lungs. Think of it as the superhighway of your respiratory system. Bronchi are the two main branches of the trachea that lead to the lungs. They're the starting points for the intricate network that brings oxygen to every cell. The singular form is called bronchus. Mucus is a thick, slippery secretion that protects and moisturizes your respiratory tissues, a natural, life-sustaining lubricant. Phlegm refers to the sticky mucus secreted during a cold or respiratory infection. Though it may be uncomfortable, it's a sign your body is fighting back. Sputum means matter coughed up from the respiratory tract, including mucus and saliva. It helps doctors diagnose what's happening inside. Runny nose refers to the excess mucus in the nose, a common symptom during seasonal changes. Remember, sometimes nature's signals are just your body's way of healing. Nasal discharge refers to fluids draining from the nose. Keeping it clear is one way your body protects itself against infections. Post-nasal drip means mucus accumulating in the back of the nose and sliding down the throat. It can be annoying, but it's also a natural response to allergens or infection. Sneezes are nature's quick reset, fun and unpredictable. Facial tissue or Kleenex seems simple, but it helps you feel a little more comfortable during those rough moments. Acute upper respiratory infection, URI. A contagious infection of the upper respiratory tract. Knowledge and early care are your best allies in recovery. A simple cough can be a signal to slow down and care for yourself. To cough up means coughing out sputum, which can help clear unwanted substances from your airways. Each cough is a step toward feeling better. Wheezing. A high-pitched sound during breathing caused by narrowed airways. Listen to your body. Sometimes a little extra care can make all the difference. Bronchitis. Inflammation of the bronchial tubes that can cause spasms and coughing. It's a reminder that even our breathing pathways sometimes need a break. Strep throat. A throat infection typically caused by streptococcal bacteria. Quick diagnosis and treatment bring swift relief and a brighter day. Antihistamine. A medication used to counteract the effects of histamine in allergic reactions. It's a tiny pill that makes a huge difference in quality of life. Decongestant. A medicine to relieve nasal congestion by shrinking swollen membranes. A clear nose often leads to a clear mind. Cough syrup, cough drops, or throat lozenges are all comforting remedies for those moments when your body needs a little burst of relief. Bronchoscopy. A procedure using a flexible tube to view the airways. It's a fascinating glimpse into the inner workings of your respiratory system. Pulmonary. Pertaining to the lungs, a word that echoes the wonder of breathing life into every moment. Respiratory therapist. A dedicated clinician who assists patients with breathing difficulties. Their care is a beacon of hope and healing. Dyspnea. Difficult or labored breathing, a condition that calls for careful attention and compassionate care. Alveoli, alveolus, or air sacs. Tiny air sacs at the end of the bronchioles where oxygen enters the blood. These microscopic marvels are crucial to every breath you take. Lobe of the lung, a section of the lung. Your lungs are divided into lobes, each playing a part in the symphony of breathing. Pleural membrane or pleura, a thin, transparent lining that envelops the lungs and chest cavity. It's a gentle shield that protects your respiratory organs. Diaphragm, the large muscle that separates the chest from the abdomen and drives respiration. Its rhythmic movements are the heartbeat of every breath. Thorax is another word for chest. Thoracic, related to the chest area, an adjective that speaks to the heart of your protective system. Pertussis, whooping cough, a contagious disease known for its spasms of deep, noisy coughing and a distinctive whooping sound. Pneumonia, lung inflammation caused by infection, where air sacs fill with fluid. Every recovery from pneumonia is a story of resilience and hope. Emphysema, a lung condition marked by the destruction of alveoli, leading to breathlessness. Your breath is precious. Cherish it and nurture your health. Chronic obstructive pulmonary disease, COPD. An umbrella term for chronic bronchitis and emphysema, conditions that remind us to take each breath with gratitude and care. Pulmonary edema, fluid accumulation in the lungs that makes breathing difficult. With every challenge, there's a lesson in perseverance and recovery. Asthma, a disorder where the airways swell and narrow, causing breathing difficulties. Each breath during an asthma attack is a call to remain calm and strong. Asthma attack, a sudden worsening of asthma symptoms, an opportunity to rally, respond with treatment, and regain control. Tuberculosis, TB, a contagious airborne disease primarily affecting the lungs. Every step toward its prevention and treatment is a victory for public health. PPD test, tuberculin skin test, Mantoux test, Perque test, TB skin test. The standard method for detecting tuberculosis infection. This simple test can be the key to early intervention and wellness. Latent, existing but dormant until triggered, much like potential within each of us waiting to shine. To spit blood, the act of ejecting saliva mixed with blood, a sign that should prompt immediate care and attention. Cystic fibrosis, a genetic condition that affects mucus clearance in the lungs. The journey with cystic fibrosis is one of courage and determination. Black lung disease, a condition caused by inhaling coal dust, a stark reminder of the importance of workplace safety and respiratory protection. Asbestosis, a lung condition resulting from inhaling asbestos dust. Awareness and prevention are key to protecting respiratory health. Pulmonary embolism, PE, a sudden blockage in a lung artery, often due to a blood clot. Quick recognition and treatment are life-saving in these moments. Inhaler, a portable device for delivering medication to the lungs, empowering you to take control of your breathing. Lung capacity, the total amount of air your lungs can hold. Every deep breath is a celebration of the capacity to live fully. Spirometer, an instrument that measures the volume of air inhaled and exhaled, a vital tool in assessing lung function. Oxygen therapy, a treatment providing extra oxygen, an essential lifeline that fuels the body's natural healing process. Oxygen face mask. A device placed over the nose and mouth to deliver oxygen. A simple tool that makes a world of difference during respiratory distress. Nasal cannula, NC. A plastic tube that delivers oxygen through your nostrils, small but mighty in its impact on improving breathing. Pulse oximeter, finger clip. A device that measures the oxygen saturation in your blood, a reminder of the invisible yet crucial forces that keep you alive. Acute respiratory distress syndrome, ARDS. A severe lung injury that demands immediate life support. Every recovery story in ARDS is a triumph of resilience. Respiratory failure. A condition where the lungs cannot provide enough oxygen to the blood. Every challenge is met with innovative treatments and the strength of the human spirit. Mechanical ventilation. A method of assisting or replacing spontaneous breathing, a marvel of modern medicine that supports patients when every breath counts. Ventilator. The machine that provides artificial respiration, a symbol of hope in critical moments. Intubated, referring to the placement of a tube into the trachea for airway protection and mechanical ventilation, an essential step in emergency care. That wraps up our rapid yet thoughtful journey through vital respiratory terms. Thank you for tuning in to Vital Terms by Language Access Academy. Stay informed, stay inspired, and keep breathing life into every moment.